Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 41 new cases of COVID-19 in Windsor and Essex County. 15 are close contacts of confirmed cases, 9 are community acquired, 1 is outbreak related, and 16 cases are still being investigated. We have had 15,970 cases since the beginning of the pandemic. 343 people are active at this time, with half of our active cases identified as having a variant of concern. To date, 1,331 preliminary or confirmed variants have been identified in Windsor and Essex County, with 92.7% of these cases identified as having the UK variant. 3 cases have the South African variant and 4 the Brazilian variant. 21 people are currently in the hospital and 3 people are in ICU. Our community has lost 421 people to COVID. I'm sorry to be reporting an additional death today. A man in his 60s from the community has passed away due to COVID. There are currently 7 active outbreaks in Windsor and Essex County, 6 workplace outbreaks, and 1 community outbreak. Regarding our vaccination rollout, 207,835 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 193,016 people have received at least 1 dose. Overall, 56.6% of adults 18 years of age and older in Windsor-Essex have received at least 1 dose of a COVID-19 vaccine. We are now inviting healthcare workers in the highest priority category to book their second doses. These healthcare workers are able to book an earlier second dose of vaccine. As you know, second doses have been deferred to 16 weeks from the first dose. Healthcare workers in the highest priority must call the call center to schedule the second dose. They will not be allowed to book online. The call center is open Monday through Friday, 8 a.m. to 8 p.m. and Saturday and Sunday, 8 to 4. The phone number is 226-773-2200. This is an opportunity for healthcare workers in the highest priority to get their second shot earlier. If you do not want an earlier date and are fine with the date of your second dose, you do not need to do anything further. For those that book an earlier date for their second dose, their original second dose date appointment will be canceled by the call center staff. Healthcare workers must bring their employment ID with them to their second dose vaccination appointment. In addition, staff and essential caregivers of long-term care homes and retirement homes are also eligible to receive their second dose at an earlier time. For all others waiting to hear from us about their second doses, please continue to be patient. We know this is information you're waiting to hear, and we are following the direction of the ministry and will notify you when we're able to book your second dose. Before I turn it over to Dr. Ahmed, I have a request for our residents who have been vaccinated outside of Ontario. In order to capture the most accurate information about vaccination coverage in Windsor-Essex County, we have created a very brief questionnaire and are requesting that those who receive the vaccine outside of Ontario take 5 minutes to visit our website and complete the questionnaire. So if you received your COVID-19 vaccine in Michigan, Detroit, another state in the US, another province outside of Ontario, or another country outside of Canada or the US, we would like to hear from you. It is completely voluntary and we do not ask for your name or any other address or identifying information. This is not a registry or a booking system. Please visit our website at www.wechu.org/CV/vaccine. If you have any questions, please contact the Health Unit at 519-258-2146, extension 1285 regarding the survey. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. So we'll just go into the weekly epi summary for this week. Okay, looking at our provincial outlook, as we can see that the cases in the province are starting to show a decline, but even as of this week, we are in the mid 2,000 cases, 2,700 cases a day, which is moving in the right direction, but still with the variant of concern and with the high number of cases poses a risk to the Ontarians. Looking at our local picture, our data is showing a declining trend, but still not where we expect it to be. It seems like it's in the last week we have seen some spikes, which is as a result of that spike, we haven't gone down to the level that we were expecting to go this week. Comparing side by side with our Windsor-Essex data from Ontario data, Ontario has shown a huge decline, but whereas Windsor-Essex, we're still at a relatively high rate. Our week-over-week case rates shows that our most recent completed week's rate is 61.4 cases per 100,000 population, which is decreased slightly from the last week, but just looking at the last 7 days with some occasional spikes, our weekly rate is 67.1 cases per 100,000 population. So this is slightly increased from last week, hoping that this is just as a result of 1 day of spike that we have seen in our region. And when the week is completed, we should be in a better spot, but we'll have to wait and see. Comparing our data with the wastewater surveillance data, similar trend, it aligns very well with some occasional spikes here and there, but overall it aligns well with our case rates, showing that the actual cases in our community is very well aligned with the number of cases that we are seeing in the community through our case finding. And just a disclaimer that this wastewater surveillance data mapping is still an experimental study and is still under development. And the final result, it cannot be used as a final result, but it's used as a preliminary finding to align and make some interpretation of the wastewater data and how it compares or correlates with the local case rates. Looking at our person positivity data, it has not changed from last week. In total, we have tested 340,168 tests as of May 8, and for the week of May 8, our person positivity was 5.2%. This slide looks at the most recent 7 days worth of data, and it just shows the person positivity and how we ranks in the province. So based on our 7 days, Windsor-Essex has the 12th highest person positivity in Ontario, sitting at 5.1%. And again, this has decreased slightly from the last week. Breaking down the person positivity data by different age group, and not much difference, but we are a slight increase among those between the ages of 18 to 34 range, as we can see in this graph. And breaking it down further by school-age children, we can see that overall it is okay, but a slight increase between the ages of 9 to 13 years of age and those 14 to 17 years of age, something that is a result of maybe testing when they're truly symptomatic, driving the person positivity number. From an overall case number perspective, a slight increase in the last week, which is takes our 7-day average to 4.7, which is slightly higher compared to the last week. Last week it was 3 cases. So this week, in the last 7 days, our week to week 7-day average is 4.7. Looking at comparing our school-age children versus overall, so our overall data is trending downwards and stabilizing right now, but a slight increase in the school-age children, as evidenced in the last graph as well. From an overall cumulative regional and provincial rate perspective, we are still at number 4 with respect to the case rates, and just want to remind everyone that at one point we were at the highest, had the highest provincial, regional and provincial rates in Ontario. So drilling it down further within the region, from May to present, our rate has been the highest in the city of Windsor, followed by town of Essex and LaSalle, and then the rest of the municipalities are listed there as well. From a distribution of case perspective, more than 2/3 of cases are coming from Windsor, while the rest of the municipalities contributing some share into the overall case rates as well. Just in the last 7 days, City of Windsor contributing almost 3/4 of the cases in the region, and the rest of the municipalities adding some numbers into the mix as well. From an age distribution perspective, almost 45% of our cases in the region are coming from individuals between the ages of 0 to 30, and that is a trend that's been ongoing for a few weeks now. From an exposure perspective, it's not much different. We still have a significant number of cases coming in as a result of community acquired, and with the majority of the cases coming from close contacts and household contacts. Breaking it down further with respect to what's happening since May, 36% of our cases are coming from community spread. And when we are saying community spread, it's basically, that means that when the case is acquired by an individual, they don't necessarily identify it with a confirmed case, and they cannot attribute it to, from a spread perspective, cannot pinpoint that it has an epi-linked source at this time. From a variant of concern perspective, we have seen some ups and downs, but still a significant number of cases in our region are coming from the variants. And the last few days' data, it's preliminary because we do get these cases of variants reported to us at least with a delay of at least 2 to 3 days. From an overall percentage perspective, we have seen that we're fluctuating anywhere between 60 to 80% in the last few weeks, which is troubling because the majority of our cases is if it's coming from variants, that means it has the potential to increase very quickly in our community, and as quickly as possible. If we can, we need to contain them, and that's why we need more accurate information from individuals to provide us with their contact information. And if we have the contact information and all the details, we can trace track early and contain it. And if anyone who is symptomatic, if they're experiencing any symptoms, please note that go for testing so we can identify it early before it spreads further. Looking at our hospitalization data, overall from the province, in the province as well as locally, we are starting to see a slight decline in the number of COVID-related hospitalization. Our COVID cases are also starting to decline in the province and in our region as well. And please note that a lot of the cases that we have in our ICUs are individuals that came from other jurisdiction to get an ICU bed. With respect to the number of individuals who lost their lives as a result of COVID, this is the breakdown by age, and as we can see, the most significant predictor for the age for death with COVID is age, and majority of the cases in our region died were 80 plus, and then trending down based on the age brackets. From a case fatality perspective, our case fatality rate is slightly higher than the provincial average, but from within the long-term care home, it's lower, and in the community, it's slightly higher. From a day-over-day comparison doubling time, we continue to do better than the province and Canada doubling time, but more recently, with some occasional spikes, we are coming closer to the case doubling Canada case doubling rate, and something that we need to be mindful of. This is also reflected in our median R0, and as we can see, the R0 has just crossed 1 again. It's now currently stands at 1.03 and has increased from last week. And as we know, when the R0 is greater than 1, each existing infection leads to more new infection, and essentially meaning that the cases continue to spread in our community. And that's why it's important that people continue to follow those measures to keep the case rates down and to decrease it an overall spread in the community. So switching gear with respect to the data into the vaccine status, and as we can see that this particular graph gives you a breakdown of number of vaccine doses administered daily in the Windsor-Essex, and we've been hitting close to 4,000 doses administered a day, and very consistently hitting close to 3,500 cases a day, which is pretty good for the region of our size. This graph breaks down the number of Windsor-Essex residents that are vaccinated with at least 1 dose by age group. And as we can see, our 60 plus coverage rate now currently stands at 84.8%. And as we go down further into the age bracket, the the coverage rates decrease slightly, but understanding the fact that some of these age brackets have just opened up, and there are many individuals who are still waiting to get the vaccine. And anyone who hasn't registered in each of these age category, I would please request them to go and book your appointment. If you're eligible, get the doses, get the vaccine as quickly as possible to keep yourself safe and keep your loved ones safe. This graph shows the cumulative percentages with individual who have received at least one doses, and as we can see, among the older age bracket, we're seeing some plateauing effect with the high coverage rate, more than 90% with the 80 plus and 75 to 79 age group. But as we go down in the other ages, there's still some opportunities for improvement. When we are going further down between the ages of 55 and under, we can see that the trend, the line is still going upwards. That means people are getting the vaccine, and we would like to see them that increase up to the point of 80-90% to provide the maximum protection for everyone in our community. This graph look at the coverage in the hotspot within the Windsor-Essex County, where at least one dose was administered. Our overall coverage with this data is 43.2%, and our hotspot coverage is slightly less than that, 40.7%. And some of the hotspot area obviously are have a higher coverage rate than the overall coverage in Windsor-Essex. Last week we reported some decline, our lower coverage rate in the N9A-BC area, and as you can see, it has increased slightly with the more targeted clinics and more pop-up clinics organized by the primary care providers, by the pharmacies. The number is starting to pick up, and anyone who's living in those areas, please use those opportunity to get yourself vaccinated as quickly as possible. This graph looks at the location of doses administered to Windsor-Essex residents. As no surprise there, as majority of our vaccines were administered through the hospital-based clinic, starting all the way from end of December to date, and followed by the public health-based mass vaccination clinic, and then through our pharmacy channels. And it's good to see that a significant number of vaccines have been distributed through our pharmacy channel. So we are utilizing all the available resources as best as possible to increase our vaccination rate. From a proportion of vaccine perspective, we can see that between the public health and hospital-based clinic, we have distributed more than 2/3 of the vaccines, and then through the pharmacy, close to 18%, and then some of these mobile delivery and long-term retirement home, those are also vaccines that are administered using our public health resources, and then the primary care physician's office and others are included in that category as well. The predominant vaccine that we have administered in our region is Pfizer-BioNTech, with a significantly high number of AstraZeneca vaccine that we have administered in our region, which has really helped us to increase our vaccination rate in our community and provide that additional layer of protection for our region. Again, from a proportion perspective, more than 2/3 of vaccines were from Pfizer, and the rest from Moderna and AstraZeneca. Again, another way to look at it from a day-over-day perspective, as we can see that the distribution of AstraZeneca has been stopped, and now majority of the vaccines are the Pfizer vaccine that we are giving out. So this is a new addition to our vaccine data that we are presenting today, and it just basically plots the coverage rates in Windsor-Essex and how it relates to the case rates in our community. And as we can see that the vaccination continues to increase in our region, our case rates have starting to slow down and going in the right direction with reduced cases every day. But we still need to make sure that those who are eligible to receive the vaccine, please get your shots as quickly as possible to provide that level of protection to you, yourself, to your family, and also put our community in a better position to reduce the risk of COVID in our community. Similar graph, but focusing just on the long-term care home and versus home versus cases. And as we can see, our coverage rate in the long-term care home is almost close to 90% coverage. And since we have increased that coverage in our long-term care home, the cases have gone down significantly in these long-term care homes. This graph looks at the coverage rate among staff in long-term care home versus cases, and as we can see that we still have a lot of opportunity to improve the staff vaccination rate, which is currently at 70%. So all these long-term care home and retirement home staff, if you're still waiting for the vaccine, please go and get your vaccine. And it's important that you're vaccinated to keep yourself safe, but also keep your residents safe. And if you haven't booked your appointment, please go and book your appointment to get your vaccine as quickly as possible. So in summary, our case rates have decreased slightly in the past week, but still at a level where we have to do better as a community. Our acquisition sources is distributed in close contacts, and almost 1/3 of the cases are still coming from the community transmission. Overall, hospitalization and ICU admission have been stabilized. It's declining in the province. Locally, quite a significant number of cases are in our ICU are people from outside of our region. Our wastewater surveillance data combined with our local case, it aligns pretty well and it's unchanged. So still there's an opportunity for us to contain the COVID-19 virus. There are cases out there. We need all these cases to go and test themselves to get a good case and contact identified, and then we can contain it. Overall, our vaccination coverage rate is 43.2% for all our residents, but just for the 18 plus population, it's more than 56% that we have the coverage rate right now. From a monitoring indicator perspective, our most recent completed weekly case rate is 61.4 cases, but just in the last 7 days, it has increased slightly, 67.1 case, mainly because of a couple of days of high case counts in our region. Percent positivity is generally unchanged from last week, 5.2%, but the most recent 7 days percent positivity slightly declined just by 0.1%, which is pretty much insignificant. The other significant number is our effective R0, which has increased from last week and is now more than 1. And as we have stated many times, that if the R0 is more than 1, that means the cases are continuing to spread and increase in our community. And if that trend continues, we'll see more cases. So please follow the public health measures, get your vaccine as soon as possible. Thank you.
We'll now take questions from the media. AM 800.
I have a couple of questions for Teresa and Dr. Ahmed. Teresa, starting with you in regards to the second doses. You mentioned who that's for. So is that considered like nurses, individuals that work at dentist office? Who is in that category?
So it does include frontline nursing staff at hospitals, critical care units, emergency departments. When you're asking about the dental staff, I don't believe they're in this category, but it's medical, first responders, mobile testing teams, vaccinators, needle exchange staff. So the list is based on the provincial guidelines, and it's in the document, the healthcare worker document. So it is, the document we're going for. So there's we're adhering to. So there is a definition for the highest priority healthcare workers. And so they're typically the people we vaccinated first in the when the vaccinations became available. This group, they were people that we had done initially. So
when were they initially done? Was this back in January, February?
it would have been, yes, around that time. So, and you know that as of March 8th or 9th, we were not able to complete any second doses. So some people may have received a second dose before that, the provincial direction to stop, giving second doses or to extend it for 16 weeks. So these people would have had their second doses probably starting in in June and July. So they're able to get it a little bit in advance.
Okay, thank you, Dr. Ahmed. Switching to you now in the presentation, just going back to the summary page, just the first line, basically how the case rates decreased the past week. I guess yesterday with the stay-at-home order being extended, I guess when residents see it, the cases here are decreasing in Windsor to some degree. I guess, do you think some might let their guard down a bit?
Yeah, and that's what I think we are concerned, and with the variants of concerns, as we know, it can increase very quickly. And secondly, some of these some of these variants may not respond well to the vaccine, and we know that there are a number of variants that can possibly be here, and so we want to make sure that people understand that while we are showing some progress, it still can change. Looking at just our case rates, and I think forget about what's happening in the province. If you're just looking at our case, 67 cases per 100,000 population, it's a high case counts for our region, and I think maybe people need to look at that number as well. We definitely are not doing too bad, but we're not out of the woods yet. We still have a case rate that can put us really quickly into a scenario where, you know, all these things that we have experienced in January and February and December timeline, it can come back. So please do not let your guard down yet. We still have some way to go. We still want our people to get the vaccine if they're eligible, and I am confident that by the end of this month, our vaccine coverage rate will be pretty good. And if we can keep our cases low at that time, we'll be in a much better spot. So please do not let your guards down. Please continue to follow these public health measures.
You mentioned in your presentation a couple of times about going to get tested if you are showing symptoms. Has the health unit noticed, I guess even the hospitals noticed, the assessment centers noticed a drop in that?
Well, we are seeing our weekly case rates close to 5,000 individuals are going through, or slightly over 5,000 cases, individuals, I shouldn't say cases, 5,000 individuals going through the assessment center to get tested. But I think when I'm looking at the community transmission rate, so we still have like 30% or more than 30% of the cases coming in from a community transmission. So two possible explanations. One is someone who is sick and they either, they're not going for testing and still going out and about and infecting other people. The other possible explanation is maybe people are not disclosing who they are coming in close contact with, and maybe they're having some of these gatherings which they're not reporting back to us. And as a result of that, they're being recorded as a community transmission where they're unable to identify a source. So both the scenario is not a good scenario to be in, because we want to trace, track, and isolate those individuals to prevent any further transmission. The most accurate information that we have, the better we can act quickly. So we are still getting those cases, we are still getting these positives, which is fine. But I think people need to know, just going back to your last question, that we're not out of the woods yet. If you have symptoms, that means you can still have COVID, and it's still circulating in our community. And more than 1/3 of the cases in our community resulting from community spread, you are at a risk. So do not let even mild symptoms go unnoticed, and go and get yourself tested. And if you have all these contacts, and even if you're having some of these meetings, which you shouldn't have at this time, but we need to know that information. Please let us know so we can better trace, track, and isolate all of these individuals to protect our community.
Thank you.
CTV Windsor.
Hi. So around the country, around the world, and I think increasingly in Ontario, there are several companies that are trying to entice residents to get vaccinated with either freebies or discounts. I know some breweries are doing it. I know Manulife has something going on. What are your thoughts about companies taking action to encourage more vaccination?
Well, I think overall, our goal is the same. We want people to get vaccinated. So that's the ultimate goal. And whatever motivates people to get the vaccine, I think it's fine. It just have to be ethical in terms of how what kind of incentives are given to them. Obviously, from a public health perspective, the most important incentive that we can give them is to get the vaccine and do your part from a community societal perspective. And overall, we all have a role to play in this pandemic. This pandemic has affected every one of us, and some more than the others. And we all have an obligation to take care of each other, to look after each other. More and more people are vaccinated, the better we will do as a community as a whole. So we want everyone to get vaccinated, regardless how they're getting the vaccine. And so I can't really comment on what incentive they're giving, but the goal is the same: get vaccinated.
CBC Windsor?
Yes. Are there any further details available about how the youth vaccine rollout will work? Will it be occurring through school boards or through the normal processes, the clinics that those avenues we already have?
So we will be meeting with the school boards today and talking about our plan, and the plan will be submitted to the ministry on Wednesday. But we'll look at every channel to distribute the vaccine. And right now that the mass immunization clinics are really very efficient and have done a great job in getting distributing a lot of vaccine throughout the 5 sites we do have, or 6 sites. And we'll use primary care and pharmacies and talk about with the school boards any other populations that may need mobile clinics. So all of that information will be coming, and we'll be starting our discussions today with all 4 school boards.
Thank you. Have you received any complaints, or has there been any enforcement done regarding people using outdoor sports amenities that aren't allowed right now?
Yeah, so I'm just looking at my team here. The only indication that I'm getting, yes, we are receiving those complaints. I don't know the full details, but we are receiving some of these complaints. And I'm sure that my team, along with our enforcement partners, are taking appropriate action based on what is allowed and what's not allowed. All the complaints that we receive, we do investigate and work with our partners for compliance and enforcement.
Do you know of any specific charges laid?
At this time, no, but as I said, we do investigate, and our goal is not to lay charges. I think our goal is to get the compliance and get them to understand, and recognizing that as the weather will improve, there will be more interest in people staying outdoors, which we all, I think, will have to be how we are engaging in that outdoor activities. I think that's the critical part, and sometimes it's just the education, it helps. If it requires some enforcement, we will, but our goal is not to penalize people, but to get compliance.
Thank you very much.
Blackburn?
Morning. Do we have any data looking at the hospitalization cases and the recent deaths and whether or not they were connected to variants?
Good question. I think there have been some deaths that was resulted from variants. I don't have a number right in front of me that how many of them. Do you want to, so maybe Teresa.
Well, it's just that we do know that 10 deaths were attributed or had the variant.
Okay, thank you.
Windsor Star?
Dr. Ahmed, I know it's difficult to talk about because there's so many things that are still to be decided. But for the general public, what should they know about their second doses at this stage? For example, the 80-plus age category. Do they have appointments for their second doses?
So I'll start and Teresa can answer, but most of these individuals or some of these individuals have received their second dose notification through the Windsor Regional Hospital clinic that they have already arranged. And the process is in place that all of these individuals who are due for their appointments, the health unit will be reaching out to them through a number of channels, through phone calls, through postcards, and making sure that they are aware of the appointment and they get to the clinic on their appointment day. So there will be opportunity for all those reminders, and the process will be starting soon, and they will start to receive some of these notifications at home, and then followed by the phone call as well.
For what if they have not received notification of second dose appointments?
As I said, they will be receiving at least 2 to 3 weeks in advance of their due date for their vaccine. So stay tuned, and there will be multiple channels that we will be using. So even the earliest, as we know, it will be end of June when some of these individuals will be due for their second doses. So we have plenty of time, and by the end of this month or before this month's end, I think third week was the timeline that we were hoping that people will start to receive notification.
For those who receive vaccination outside of the VVAC system, maybe outside the region, or maybe they were part of the AstraZeneca doses, what should they expect for their second dose? Will they also be notified, or do they have to contact the health unit?
So those are the individuals that will have to. We don't have a good line of insight, and maybe I'll pass it on to Teresa, because we did launch another survey just to capture some of those individuals who were not in the provincial registry at all, and how they can get the vaccine. So I am aware of at least one person who got their vaccine out of Ontario, and we're looking to get their second dose based on the timeline, which is 16 weeks at this time, to get their second dose, and they receive their doses. But for others, the system that we are launching, it will give us a sense of how many of these individuals are out there and what we need to do. I don't know, Teresa, if you want to add on that.
No, just that the people that they received their vaccine or first dose outside of Ontario, and it's getting close to their 4 months, the 16-week interval, they can call our call center and book for their second dose. But we are adhering to the provincial guidelines right now of the 16 weeks, unless you're one of the prioritized healthcare workers or other groups that are having earlier doses.
And finally, is there anything you can say to comfort those who may have some anxiety about what's happening with their second doses? Whether they got the AZ vaccine, or whether they're worried about mixing doses and so forth?
Well, I'll start. So people that are waiting for their second doses, depending on when they received their first dose, they can, see where 16 weeks lands them. And that's around the time that we're expecting to give people their second doses. If there is a big influx of vaccine or the ability to do that quicker, we will. So as you know, the healthcare workers will have a shortened interval, and that, may open up to other groups. If it does, we'll be figuring out pathways and communications to make sure everyone knows that. The next group, as you may be aware, is that we did the 80 plus group. And so they would be the population that would be next waiting for their second appointments. And right now, some have the appointments because they were done at the Sportsplex or the Windsor Hall. And so they may have their second appointment notifications. Those done at WFCU or any of the other sites would not have any communication from us quite yet. We know that those other clinics, WFCU, Nature Fresh in Leamington, and the Libro Center, that we started a little bit later, and that our second doses for people in the 80 plus group are probably due the week of June 24th. So we do have some time. We would ask that they, will continue to give as much information as possible. We are working on the background to try to firm up all of the timing of when communication goes out to everybody. We haven't done that yet for the 80+ group. So if you are in that age range, we will reach out to you. We'll make sure that you have the opportunity to have that second dose based on the timelines. For anyone who received AstraZeneca in a pharmacy, right now the second dose is 16 weeks at this time. There's been no confirmation about mixing doses or anything else. And so as we get more direction from the province and the ministry again, we will make sure we communicate that to our population so they're aware of next steps.
Thank you.
Any additional questions from AM 800?
I have one for Teresa. Teresa, we got an email from a listener just in regards to children 12 and up. I'll just read the question for you. Teresa, why are children 12 and up with high and highest medical risk conditions left out of the vaccine rollout while a healthy 30-year-old can get the vaccine?
So the province just announced yesterday that we are moving forward with ages 12 to 17. Prior to that, we did not have any direction from the province to vaccinate those groups, although there are people with medical conditions that are younger than 18 that have received the vaccine. So the provincial direction right now is was 18 plus, and there were some people younger than that, 16, 17 and 18 that did receive the vaccine. So the information is just now out to develop a strategy and a plan for the 12 to 17-year-olds, and we will do that and vaccinate people. Vaccinate the groups that we're asked to do at this time, and we're happy that they're included, and we're going to make sure that we roll that out. So I can't speak to the 30, why the 30-year-old came before the 12 to 17-year-old. We're moving down the age bands, and based on this new information from the province, we will, move with this information as well.
Thank you. One quick one for Dr. Ahmed. Dr. Ahmed, I know one of my colleagues asked this question earlier this week just in regards to the AstraZeneca and the blood clots. At that time, you told us you don't believe there has been any Essex. Has anything changed since, I think it was Monday or Tuesday when the question was asked?
Not to my knowledge, no. I think I still have the same information that no case of blood clot reported in Windsor-Essex as of today, or to my knowledge. So we are doing pretty good. And we just need to make sure that we have a plan for the people who are waiting for their second doses. I think that's a critical piece that we are trying to figure out right now.
Thank you. Have a great weekend.
Thank you.
CTV Windsor?
Hi, sorry, just to clarify, because I know we don't exactly always align with the province. So they're planning on doing 18 plus starting May 24th, the week before 12 to 17. So how are we doing it exactly, or do we know for all 18-year-olds plus? Where are we at right now?
So I can't answer this question right now. We'll have to continue to look at our data and look at our vaccine distribution, look at our appointments, what it looks like, and we'll make some of those decisions as it comes. But right now, I can't give you an indication. Obviously, we try our best to align with the province, but sometimes if our local data allows us to go before or after, it all depends on some of the data. So I can't answer, but we'll do our best to give out the vaccine to everyone in our region as quickly as possible.
Thank you.
CBC Windsor?
There were several deaths in the last week or so, and I believe that most of those who passed away were all within vaccination age. Do you know of their vaccination status? Is that something that the health unit tracks?
We do track that, and I don't have the exact data on the recent cases that we are reporting, and I think that right now the system doesn't talk correctly, that and we have to do some of that manual work, which we do, and maybe I can comment it next week if any of these individuals were vaccinated or not. But generally speaking, our vaccination or breakthrough cases in our region has been pretty low, with individuals who are vaccinated and still got sick, unless they are in their first 14 days of receiving their vaccination. So I can maybe look at that data and provide some details next week.
Thanks very much.
Blackburn?
To the previous question about second doses and the health unit run clinics. If an individual 80 and over has some appointment, say and what they live in Windsor, would have an option to book closer to home, or will they have to go to where they originally got their vaccine?
So if I heard your question correctly, you're asking, because you were breaking up a little bit, so 80 years and older, where they receive the vaccine, they have to go to the same spot, or if they can change, is that your question?
Yes, for their second dose.
Yeah, so I think the plan would be when they are booking for their second doses, they will have the option to book the one that's available. And if they want to go to the same spot, they can. Yeah, so there will be an opportunity for them to choose where they want to book the appointment.
And I guess Moderna, whereas most of the clinics now have fine. Like whether you hand out days for the same vaccine, or how will that work?
So you were breaking up again, so maybe what I am hearing from you is you're asking that if they receive Pfizer or Moderna, will they be getting the same vaccine? I think that's the plan, and we are looking to make sure that that's what happens. And at that time, I think most of the mass vaccination clinic, we were using Pfizer for that age group, and the long-term care home, retirement home individuals who have received the vaccine, there is most of them received the Moderna vaccine. So we are trying to make sure that that happens, and it's I can't imagine that it would be very rare for them to get the other vaccine if they haven't received the first one, the same one.
Okay, I mean, I know this is very personal, but I know my grandmother got the Moderna at a mass vaccination site, so I'm sure others are in that position as well. So when that individual books, they'll be able to say, yes, doing Moderna at that mass vaccine site that day.
Yeah, so that's what, so when they will book for their second appointment, the booking agent, they will know that which vaccine they've received first, and then it would help them to put them in a clinic with the same vaccine.
Okay, thank you.
Windsor Star?
Nothing further, thank you.
Thank you, everyone.
Thank you.